Hello everyone, I am Dr. Lokesh Handa. I am Senior Consultant Plastic Surgeon practicing in South Delhi. Today we will be talking about recovery from hair transplant. Now this hair transplant procedure, it is a day care procedure, and once the procedure is finished, we send the patient back home the same day with all the dressings and with the medications, which usually include the painkillers, the antibiotics and medications to reduce the swelling. After 2 to 3 days, the patient comes back to the clinic for the first head wash. Then the head wash is done, the dressing is removed, head wash is done in the transplanted area, in the donor area, and the patient is also taught how to do the head wash subsequently daily at home. And usually this is done with a very gentle baby shampoos by making foam with the water, and you can simply dab the transplanted hairs in the front region or in the back, wherever the transplanted hairs are there. So just dab all those hairs with this shampoo water and then clean it, rinse it thoroughly. And even to dry it, use a dry towel, clean towel to dab the area. You don't have to rub this area basically, so that the transplanted hairs are not shedded or they are not pulled out. Then the next follow-up is usually after 10 days, where we call the patient back again to do another head wash, where we remove all the scabs from the transplanted area. And then at that time we do a gentle rubbing in that area to take out the scabs. And once all the scabs are removed, then patient can wash his head daily with gentle rubbing. And even if they have to dry with the towel, they can rub it very gently. And in 21 days time, that means 3 weeks time, then you can do a normal shower. Even you can rub the head with the way you are normally doing. So then after 21 days you don't need much precautions. Now once the hair transplant done, then what is the position with which you can lie on the bed? So that is very important, and it also depends on which area the transplant is done. If the transplant is done in the frontal region, then you can lie sideways. If the hairs are not transplanted on the sides, then you can take a little bit of turns while sleeping, but mainly you have to sleep on your back. And if the frontal and the crown or the crown area is involved, then you have to ensure that while you're sleeping, this area should not touch in the back of the bed. So maybe you can sleep on the sides of the bed with the head on the side, resting on the side, with the pillow underneath the head. So that's very important, the precaution that you need to take while sleeping. The next thing is the role of exercise, that when you can start resuming exercise. These are usually done after 3 weeks. You can start doing all the exercises, the aerobics or weight training, whatever you want, or the sports activity, jogging, running. You can start all these exercises after 3 weeks time. And even the water sports, if you want, like swimming, you can start after 3 weeks time. So this is basically all the major aspects of the recovery in the transplant. So in case you have any further queries, you can contact at this number. You can ask me, or my staff will be very willing to help you out. Thank you.